Okay, so the second lecture is trauma and stress related disorders. يعني من اسمها رح نحكي عن how trauma affects people and how stress can affect people. So we'll talk about 3 disorders here. إشي اسمه PTSD أو post-traumatic stress disorder، إشي اسمه ASD أو acute stress disorder، والإشي الثالث اللي هو adjustment disorder. ال PTSD. Okay. This is a case. Mr. M sought treatment for symptoms, Mrs. M sought treatment for symptoms that she developed in the wake of an assault that had occurred about 6 weeks prior to her psychiatric evaluation. While leaving work late one evening, Mrs. M was attacked in a parking lot next to the hospital in which she worked. She was raped and badly beaten, but was able to escape and call for help. On referral, Mrs. M reported frequent intrusive thoughts about the assault, including nightmares about the event and recurrent intrusive visions of her assailant. She reported that she now took the bus to work to avoid the scene of the attack, and that she had to change her work hours so that she did not have to leave the building after dark. In addition, she reported that she had difficulty interacting with men, particularly those who resembled the attacker, and that she consequently avoided such interactions whenever possible. Mrs. M described increased irritability, difficulty staying asleep at night, poor concentration, increased focus on her environment, particularly after dark. So this is a case of PTSD. رح نحكي هلا عنها أكثر عشان تفهموا بس So PTSD disorder and acute stress disorder are marked by increased stress and anxiety following exposure to a traumatic or stressful event. The response to the traumatic event must involve intense fear and horror. Traumatic or stressful events may include being a witness to being involved in a violent accident or crime, military combat, assault, or being kidnapped, being involved in a natural disaster, or experiencing systematic physical or sexual abuse. So الشخص هون بيتعرض لتروما قوية. هاي التروما لازم يكون بس يتعرض لها يكون حاس بخوف شديد، وهاي التروما ممكن هو يتعرض لها أو يشوفها قدامه أو يسمع حدا قريب منه صارت معاه هاي التروما وبعديها تصير عنده مجموعة من الأعراض. The lifetime incidence of PTSD about 9 to 15%, and the lifetime prevalence estimated about 8%, higher in females 10% and 4% in males. 30% of men develop full-blown PTSD after having served in the Vietnam War, according to the survey. Although PTSD can appear at any age, it's most prevalent in young adults because they tend to be more exposed to precipitating situations. The most important risk factors are the severity, the duration, and proximity of the person's exposure to the actual trauma. يعني كل ما كانت التروما severe، كل ما كانت مدتها أطول، وكل ما كان الشخص قريب من هاي الأكشوال تروما أو قريب من الإكسبوجر إلها، كل ما كانت ال PTSD أقوى. A family pattern seems to exist as first-degree biological relatives as first-degree biological relatives of persons with a history of depression have an increased risk for developing PTSD following a traumatic events. يعني هدول الأشخاص العيال عندهم عرضة أكثر يصير عندهم كمان depression. Etiology, stressor by definition. Stressor is the prime causative factor in the development of PTSD. Not everyone experiences a disorder after a traumatic event, however. The stressor alone does not suffice to cause the disorder. The response to the traumatic event must involve intense fear or horror. Clinicians must also consider individuals' pre-existing biological and psychosocial factors and events that happened before and after the trauma. For example, a member of a group who lived through a disaster can sometimes better deal with trauma because others have also shared the experience. The stressor's subjective meaning to a person is also important. For example, a survivor of a catastrophe, هاي كلمة واحدة, may experience guilt feelings اللي بيسموها survivor guilt that can predispose or exacerbate PTSD. Biological factors, many neurotransmitter systems have been implicated in clinical population. Data have supported hypotheses that our noradrenergic and endogenous opiate systems, as well as the HPA axis, are hyperactive in at least some patients with PTSD. Other major biological findings who increase activity and responsiveness of the autonomic nervous system, as evidenced by elevated heart rates and blood pressure readings by abnormal sleep architecture. يعني حكينا مش كل الناس اللي ممكن يتعرضوا لتروما رح يصير عندهم PTSD، لكن في factors predisposing factors اللي هم أول وحدة presence of childhood trauma, borderline paranoid dependent or antisocial personality disorder traits, inadequate family or peer support system, female gender, genetic vulnerability to psychiatric illnesses, recent stressful life changes, recent excessive alcohol intake. هلا DSM-5 criteria أول وحدة لازم يكون عندنا تروما زي ما حكينا exposure to actual or threatened death, serious injury or sexual violence in one or more of the following ways. أول وحدة اللي هي directly experiencing the traumatic events، يعني ممكن الشخص هو نفسه يكون exposed للtraumatic event أو يكون witness شاهد in a person that events that occur to others، مثلا يكون موجود يشوف حادث سيارة قدامه، يشوف حريق قدامه. Learning learning the traumatic events occurred to a close family member or a close friend. In cases of actual or threatened death of a family member or friend, the events must have been violent or accidental. For experiencing repeated or extreme exposure to aversive details of the traumatic events. يعني زي الأشخاص paramedics أو police officers, they are repeatedly exposed to details of child abuse أو first responders اللي هم collecting human remains after a catastrophe. هدول كمان عرضة إنه يصير عندهم PTSD. B, we need at least one or more of the following إشي بنسميهم intrusion symptoms associated with the traumatic events beginning after the traumatic events occurred. بدنا واحدة من هدول الخمسة. أول واحدة recurrent involuntary intrusive distressing memory of the event. الشخص بضلها تجي يذكر التروما اللي عم بتصير غصب عنه وبضلها تخطر بباله كتير. أو recurrent distressing dreams in which the content and or effect of the dream are related to the traumatic event. في أحلام مزعجة. 3 dissociative reactions such as flashbacks in which the individual feels or acts as if the traumatic events were reoccurring. يعني الشخص بيكون صاحي بس فجأة بتجي زي flashback بيتذكر كل التروماتيك event بيحس بنفس الشعور. 4 intense or prolonged psychological distress at exposure to internal or external cues that symbolize or resemble an aspect of the traumatic event. يعني الشخص بس يتذكر إشي بخص الموضوع، يعني رجع مر من الشارع اللي صار فيه الحادث أو شاف حدا ذكره في هذا الحادث، بصير عنده intense prolonged psychological distress يعني fear, anxiety, panic. أو 5 marked physiological reaction لما كمان يتعرض لكيو أو أي شيء بيذكره في هذا الحادث، ممكن يصير عنده palpitations, shortness of breath, chest pain. C عندنا persistent avoidance. بدنا واحدة من هدول التنتين، إنه الشخص بده يتجنب أي شيء بيذكره بالtraumatic event. أول شيء avoidance or efforts to avoid distressing memories, thoughts, feelings about or closely associated with the traumatic events. يعني كل ما يحاول تجي تخطر بباله فكرة دغري بيعمل avoidance إلها. 2 avoidance or efforts to avoid external reminders, people, places, conversations, activities, objects, situations that arouse distressing memories, thoughts or feelings about or closely associated with the traumatic events. بتجنب الأماكن، الأشخاص، زي المثال اللي حكيناه، صارت تتجنب المريضة إنها تطلع بعد الليل، تتجنب إنها تحكي مع الرجال. فبدنا واحدة من هدول التنتين. بعدين بدنا تنتين من هدول السبعة اللي هم negative alterations in cognitions and mood associated with the beginning or worsening after the traumatic event. أول واحدة اللي هي inability to remember an important aspect of the traumatic event. يعني typically due to dissociative amnesia and not to other factors such as head injury, alcohol or drugs. يعني الشخص بيعمل زي فصل للموضوع dissociation وبيبطل يتذكر ال traumatic event. 2. Persistent and exaggerated negative beliefs or expectations about oneself, others or the world. دايما عنده negative expectations, I am bad, no one can be trusted, the world is completely dangerous. 3. Persistent distorted cognitions about the cause or consequence of the traumatic event. يعني بيسموها survivor's guilt، بصير يلوم على حاله. 4. Persistent negative emotional state، دايما حاس إنه هو أعصابه متوترة، خايف، guilty، معصب. 5. Markedly diminished interest or participation in significant activities، يعني anhedonia. Feelings of detachment or estranged from others، بحس حاله يعني مفصول عن العالم اللي حواليه أو عن الأشخاص. 7. Persistent inability to experience positive emotions, inability to experience happiness, satisfaction or loving feelings، يعني ما عندهم reactivity للأشياء اللي بتصير حواليهم. في عنا الأراوزل and reactivity بدنا 2 of the following. 6. 1. Irritable behavior and angry outbursts، بصير عندهم غضب مفاجئ typically expressed as verbal or physical aggression toward people or objects. Reckless or destructive behavior, self-destructive behavior. Hypervigilance اللي هو الأشخاص هون بيكونوا hyper alert، دايما متيقظين في مواقف معينة. Problems with concentration, exaggerated startle response، هدول ممكن يتجفلوا من أي صوت أو من أي شغلة بتصير معاهم، وعندهم difficult sleep or restless sleep. هلا duration عشان نحكي PTSD we need more than 1 month. لازم تأثر على الشخص بالfunctioning تبعه، و it's not attributable to the physiological effect of a substance or another medical condition. في عنا بعدين acute stress disorder. ال DSM-5 criteria تبعه ما رح أعيدها، لكن الفرق إنه إحنا هون غير الإكسبوجر للتروما بدهم 9 or more of the symptoms اللي إحنا حكينا عنهم، مش بالتفصيل زي ال PTSD بدهم مثلا واحدة من intrusion symptoms، واحدة من involuntary أو ال avoidance symptoms. هون بدنا 9 generally من الأشياء اللي حكيناها، نفس السيمتومز تبعت ال PTSD، لكن بيقدروا يختاروا أي 9 منهم. والشغلة الثانية المهمة إنه duration of acute stress disorder بتكون بين 3 days ل 1 month، مش أكثر من 1 month. متى ما استمرت أكثر من 1 month إحنا هيك بنحكي عن PTSD. course and prognosis of PTSD usually develops sometime after the trauma، لكن ممكن يكون في delay تقريبا 30 سنة بعد التروما تظهر أعراض ال PTSD. Symptoms can fluctuate over time and may be most intense during periods of stress. Untreated, about 30% of patients recover completely. 40 continue to have mild symptoms. 20 continue to have moderate symptoms, and 10% unchanged or become worse. After 1 year, about 50% will recover. Good prognosis بيكون لما يكون عندنا rapid onset of symptoms, short duration of symptoms less than 6 months, good premorbid functioning, strong social support, absence of other psychiatric, medical or substance-related disorders. In general, the very young and the very old have more difficulty with traumatic events than do those in midlife. Comorbidity rates are high among patients with PTSD. About 2/3 will have another 2 other disorders such as depression, substance-related disorder, anxiety, bipolar. طبعاً comorbid disorders make persons more vulnerable to develop PTSD. Differential diagnosis of PTSD and ASD عندنا head injury during the trauma, epilepsy, alcohol-related disorders or other substance-related disorders, panic disorders, generalized anxiety disorders. Treatment. When a clinician is faced with a patient who has experienced significant trauma, the major approaches are support, encouragement to discuss the event, and education about a variety of coping mechanisms. Additional support for the patient and family can be obtained through local and national support groups. في عنا إشي اسمه EMDR اللي هو Gold Standard Treatment for PTSD, eye movement desensitization and reprocessing. يعني in short هي عبارة عن eye movement. بنطلب من المريض إنه يحرك عيونه يمين وشمال حسب حركة أصابعنا أو حسب جهاز معين. وفي ستبس فيها إنه بيحاول هو عم بيحرك عيونه يتذكر التروما اللي صارت والسيتويشن اللي صارت. إلها كتير sessions. after a while بيلاقوا إنه هاي الآي movements تعمل release of repressed memories اللي كانت موجودة. يعني هي إذا بتحبوا تقرأوا عنها بعدين، بس هي الجولد ستاندرد تريتمنت لل PTSD. لكن إحنا كمان ممكن نستخدم SSRIs، tricyclics، antidepressants. في عنا البرازوسين اللي هو alpha 1 blocker اللي هو for treating disturbing dreams and nightmares. البنزودايزابينز كمان used for anxiety، لكن we always try to avoid benzodiazepines لأنه هدول المرضى عرضة أكثر إنه يصير عندهم dependence عليهم. طبعا psychotherapy حكينا، behavioral therapy، hypnosis. في حدا عنده سؤال هون على ال PTSD وال ASD؟ تمام. رح نحكي آخر شيء عن adjustment disorder. So adjustment disorders are characterized by an emotional response to a stressful event. Typically, the stressor involves financial issues, a medical illness, or relationship problem. The symptoms complex that develops may involve anxious or depressive affect or may present with a disturbance of conduct. By definition, the symptoms must begin within 3 months of the stressor. يعني هون الشخص بيصير عنده stressful event مش سيفير كتير زي أو مش بضرورة تكون سيفير زي تروما زي ال PTSD. ممكن تكون relationship problem، financial issue، تشخص بمرض جديد، بلشت عنده تظهر أعراض قريبة من الانكزايتي، من الدبريشن، ممكن disturbance of conduct. لكن الشرط إنها تظهر هاي الأعراض خلال 3 months of the stressor وتختفي بعد اختفاء الستريسر ب 6 months. subtypes في عنا adjustment disorder with depressed mood. ممكن يكون adjustment disorder تظهر عنا mixed anxiety and depressed mood. adjustment disorder with disturbance of conduct حكينا هدول اللي بعمرهم أقل من 18 سنة اللي بيشبهوا الانتي social personality disorder. كمان في عنا adjustment disorder with mixed disturbance of emotion and conduct و adjustment disorder unspecified. Epidemiology, 2 to 8% of the population, female to male ratio 2 to 1, and single women are generally overly represented as most at risk. In children and adolescents, female to male ratio is 1 to 1. هلا the disorders can occur at any age but more frequently in adolescents. Among adolescents, common precipitating factors are school problems, parental rejection and divorce, and substance abuse. Among adults, common precipitating factors are marital problems, divorce, moving to a new environment, and financial problems. The criteria عندنا development of emotional or behavioral symptoms in response to an identifiable stressor. So في هون شرط إن لازم يكون عندنا stressor occurring within 3 months of the onset of the stressor. These symptoms or behaviors are clinically significant as evidenced by one or both of the following. أول إشي عندهم marked distress that is out of proportion to the severity or intensity of the stressor, taking into account the external context and the cultural factors that might influence symptom severity and presentation. 2. Significant impairment in social, occupational, or other areas of functioning. هلا stress-related disturbance does not meet the criteria for another mental disorder and is not merely an exacerbation of pre-existing mental disorder. يعني المريض تعرض فرضاً مراهق غير مدرسته، نقل على مدرسة جديدة وصارت تظهر عنده أعراض anxiety أو conduct أو depression، لكن it does not fulfill the criteria for any of those disorders. متى ما صار fulfilling the criteria of depression خلاص إحنا بنسميه depression. فهي بتكون أعراض مش كافية لتشخيص الdepression ولا الanxiety ولا الconduct. Once the stressor، طبعاً symptoms do not represent normal bereavement. هنا عم نحكي عنه الجريف، يعني أي شخص صار عنده stressor إنه فقد شخص حدا عزيز عليه هذا بنسميه grief bereavement، ما دخله في الadjustment. هلا once the stressor or its consequences have terminated, the symptoms do not persist for more than 6 months. Differential diagnosis of adjustment disorder حكينا ممكن يكون اللي هو الجريف أو bereavement, depression, brief psychotic disorder, generalized anxiety disorder, somatic symptom disorder، حدا عنده substance related disorder, conduct disorder أو PTSD. With appropriate treatment, the overall prognosis is generally favorable. Most patients return to their previous level of functioning within 3 months. Some persons, particularly adolescents, will later have a diagnosis of mood disorder or substance-related disorder. Adolescents typically require longer time to recover than adults. Risk for suicide, especially in adolescent patients with depressed mood subtype. Comorbid diagnosis of substance abuse and personality disorder increase the risk of suicide. التريتمنت احنا بالعادة ما بنستخدم medications، بس بالعادة psychotherapy أو reassurance هو treatment of choice. الفارماكوثيرابي ممكن في بداية نعطي شوية benzodiazepines عشان نخفف الانكزايتي أو إذا عندهم insomnia، بس بنحبش إنه نطول فيهم طبعاً عشان dependence. هلا الآخر شيء notes the presence of a stressor is a requirement for the diagnosis of PTSD, ASD and adjustment disorder. لكن PTSD and ASD have the nature of the stressor better characterized and are accompanied by defined constellation of affective and autonomic symptoms. يعني الأعراض تبعتها واضحة حسب الكريتيريا. In contrast, the stressor in adjustment disorder can be of any severity with a wide range of possible symptoms. When the response to an extreme stressor does not meet the acute stress or PTSD threshold, the adjustment disorder would be appropriate. في حدا عنده أي سؤال لحد هون؟ واضحة الأمور؟